Blood pressure information.
Your heart pumps blood around your body to deliver energy and oxygen. A certain amount of pressure is needed in your blood vessels to do this. However, if there's too much pressure in your blood vessels, it puts strain on your arteries and heart. This can lead to diseases such as heart attack, stroke, or kidney disease. Your blood pressure reading is two numbers. It is written as, for example, 130 over 85 millimeters of mercury. The first number is called the systolic pressure. It's the pressure of the blood when your heart pumps the blood out. The second number is called the diastolic pressure. It's the pressure of the blood when your heart rests in between beats. If your blood pressure is high, it's sometimes called hypertension.
Taking your blood pressure at home. Don't rush straight in from exercising or a stressful journey to take your blood pressure. Don't have a drink containing caffeine, eat a heavy meal or smoke within the half hour before taking your blood pressure. Don't talk while taking your blood pressure. Aim to take your blood pressure at around about the same time, preferably sometimes in the morning and sometimes in the evening. Sit comfortably in a chair that supports your back and have a desk or table in front of you. Keep your feet flat on the floor and don't cross your legs. Make sure you're wearing something loose enough to allow you to uncover your upper arm and it isn't too tight. Then take 5 minutes to sit and relax. You should use the same arm each time. If you're right-handed, use your left or vice versa. Put on the blood pressure cuff with the bottom 1 inch above your elbow. The tubing or arrow mark should be in the centre at the front of your arm. Now tighten the cuff so you can just fit in 2 fingertips and make sure it's evenly tight at the top and the bottom. Rest your arm on the table so your forearm is about level with your heart. Stretch your arm out with the palm facing upwards. Now press the button on the machine. Sit still, breathe normally and don't talk while the machine is working. You will feel the cuff tighten and then untighten. Then record your measurement. Wait a couple of minutes and take another measurement. In this reading, the systolic is 132 and the diastolic is 85. If you're using Florence, the home health monitoring system provided by your GP, send in the lower reading. If you find there's a difference of more than 10 in the systolic or higher figure between the two readings, then wait a few more minutes. Do it again and send in the lowest of these to Flo.
What if I get a high result that I don't usually have?
Individual raised blood pressures are not so important. Doctors are more interested in the pattern of your blood pressure over time.
What if my results are repeatedly high?
If your blood pressure is higher than 170 over 105 and it still remains as high when you check it an hour later, make an appointment to see your doctor or nurse within the next couple of days. If your blood pressure reaches 200 over 105 and it is still as high when you check it an hour later, this is very high. Phone your doctor urgently today. Phone the surgery, or if it's at night or a weekend, phone the urgent out-of-hours contact and speak to the doctor who will agree when you need to be reviewed.
If my blood pressure is good, can I stop my medication?
It is very important to continue to take your medication. Your blood pressure is normal because of the medication. If you stop taking the medication, your blood pressure will probably rise over the next few weeks. Never stop your medication without consulting your doctor or nurse.
What else can I do to help my blood pressure?
You can do a lot besides take your medication to help your blood pressure. If you're overweight, getting this down can make a big difference to your blood pressure. If you're able to exercise, then regular aerobic exercise such as walking or swimming can help lower your blood pressure. You should aim to exercise for 40 minutes 3 times a week or more. Getting off the bus a stop early or taking stairs rather than lifts. If your health does not permit this, then getting up out of your seat once an hour and walking around the house is better than sitting all the time. Reducing your salt intake can make a big difference to your blood pressure. Most of the salt we eat comes pre-packaged in food rather than adding salt to food. However, most products nowadays tell you how much salt is in them. You should aim for less than 3.5 grams each day.
For further information, explore the Living It Up website.